You walk into a room and forget why you went in there. For half a second, your stomach drops. Is this just a senior moment, or is something actually wrong? If you felt that fear for yourself or watched it on a parent's face, here's something worth knowing. Memory changes in older adults aren't always about a disease process starting. Sometimes the cause is sitting quietly in the medicine cabinet, and it's something a doctor can help untangle once it's actually pointed out to them. Today, we're looking at 3 categories of commonly prescribed medications that are worth a real conversation with your doctor or pharmacist if memory changes have shown up recently. Not because they're dangerous for everyone, but because their effect on thinking is easy for a busy medical system to miss. Think of this as a checklist for your next appointment. By the end, you'll know exactly what to ask and why these effects happen in the first place. Let's get into it. So why does this even happen? Here's the simple version. Your brain runs on a delicate balance of chemical messengers, signals that control things like alertness, memory formation, and how fast your thoughts move. A lot of medications, even ones that have nothing to do with the brain on the label, work by turning certain chemical signals up or down somewhere in the body. In younger adults, the body usually compensates well. But as we age, 2 things change. The brain has less reserve capacity to absorb that interference, and the liver and kidneys process medications more slowly, so effect can quietly build up over time without anyone connecting the dots. And here's the structural problem nobody talks about enough. A typical doctor's visit is short, often built around one main complaint at a time. If someone's seeing 3 or 4 specialists, each prescribing separately, there may not be one person looking at the whole list together and asking, could these be adding up? That's not negligence. It's just how a fragmented system works. The 3 categories we're covering today all interfere with the brain's chemical signaling in different ways, and I'll keep coming back to that idea as we go. Let's start with the first category, medications that block a signal in your brain called acetylcholine. You'll sometimes hear these called anticholinergic medications, and what makes them sneaky is how ordinary and routine they look on the shelf. They show up in some allergy remedies, some bladder control medications, certain muscle relaxants, and a few older generation antidepressants. People underrate this category because each individual pill seems harmless, the kind of thing grabbed without a second thought at the pharmacy counter. But acetylcholine happens to be one of the main signals your brain relies on for memory formation and attention. Block it a little, and the effect might be barely noticeable. Block it from 2 or 3 sources at once. An allergy pill here, a sleep aid there, something else layered on top. And the combined effect on an older adult's thinking can be far more noticeable than any single one alone. This stacking effect is sometimes called anticholinergic burden. And it's exactly the kind of thing that's easy to miss unless someone sits down and reviews the entire list together, prescription and over-the-counter, side by side. The general guidance here isn't to stop taking anything. It's to bring your full medication and supplement list to one appointment and ask specifically about this category by name. How much it matters varies enormously from person to person, which is exactly why this is a conversation for your own doctor or pharmacist, not something to figure out alone. If this kind of video, one that explains the why instead of just throwing out scary symptoms, is useful to you, subscribing helps it reach more people who need it instead of the panic-driven version of this topic. And once you've got all 3 categories, I'd love to know in the comments. Has anyone in your life had a medication adjusted and noticed their thinking got clearer afterward? Those stories are honestly why I keep making these. Now let's get into Category 2. Category 2. Sedatives and sleep aids that slow down your central nervous system. The broad family that includes benzodiazepines and similar calming medications often prescribed for anxiety or sleep. These get underrated for a different reason than Category 1, where anticholinergics hide because they seem harmless. this category gets a pass because the short-term effect feels like exactly what someone wanted: a calmer mind, an easier night's sleep. Nobody complains the morning after they finally slept 8 hours. The trouble is what happens with consistent, long-term use, especially in an older body. Think of your brain's alertness system like a dimmer switch instead of an on-off switch. These medications turn that dimmer down on purpose every single day so you can fall asleep or feel less anxious. But your memory formation process needs a certain amount of light to work properly. Your brain needs to be reasonably alert to file new information away and retrieve old information cleanly. Turn the dimmer down every day for months or years, and that filing system gets sluggish even during the hours you're technically awake. There's another layer too. These medications can affect balance and coordination, which raises fall risk, and falls themselves are a separate, very real path toward cognitive decline in seniors, especially if a fall leads to a head injury. The general guidance, again, isn't to stop anything abruptly. Some of these medications genuinely should not be stopped suddenly without medical supervision. That's a separate safety issue entirely. It's to ask your doctor at your next visit whether the original reason for starting this medication is still the best fit today, or whether there's a lower impact alternative worth discussing. That's a signal interference conversation, just like category 1, just dialing a different switch. Before we get to the third category, here's something worth doing right now, while it's on your mind. If you're watching this because of a parent or spouse, send them this video, or better yet, send it to whichever sibling or family member usually goes to the doctor's appointments with them. A lot of people watching this know exactly who in their life needs to hear it. Tag that person, share it with them, or just bring up the conversation tonight. The earlier this gets brought to a doctor's attention, the easier it is to actually do something useful with it. Category 3. Medications that affect blood pressure and blood flow more broadly than people expect. This one surprises people the most because on the surface it has nothing to do with the brain at all. It's prescribed for the heart for blood pressure numbers for circulation. But your brain is, more than almost any other organ, completely dependent on a steady, well-regulated blood supply. It needs constant oxygen and glucose delivered at a stable rate to keep memory and thinking sharp. Some blood pressure medications, when the dose is a bit too strong for a particular person's body, can drop blood pressure lower than intended, especially upon standing up, a pattern called orthostatic hypotension. When that happens repeatedly, even mildly, the brain experiences small, repeated dips in blood flow. Over time, those dips can show up less as obvious dizzy spells and more as a kind of mental fog or slower recall that's easy to mistake for normal aging. This connects right back to that same signal interference idea from earlier. Except here, it's not a chemical messenger being blocked, it's the fuel supply itself being interrupted in small, repeated waves. The general guidance here is genuinely simple and low risk to act on. Ask your doctor to recheck your blood pressure both sitting and standing at your next visit, and mention if you've noticed dizziness on standing alongside any memory changes. This is one of the more fixable items on this list, because sometimes it's a dosing conversation rather than a stop the medication conversation at all, and that's worth knowing before assuming the worst. That's all 3 categories. Notice the pattern running underneath each one. A chemical signal getting blocked, a dimmer switch getting turned down, or a fuel supply getting interrupted. 3 different mechanisms, but all of them quietly interfering with how the brain does its job. None of these are about a single bad pill. They're about an accumulation that's easy for a fragmented system to miss and easy for a focused conversation with one doctor to catch. Let's make this concrete with a hypothetical example. Not a real patient, just a composite picture built from the kind of pattern that shows up often enough to be worth describing. Picture someone like Margaret, 74 years old, living alone since her husband passed a few years back, still driving herself to her weekly bridge game and proud of that independence. Over the past year, her daughter started noticing small things. Margaret repeating a question she'd asked 20 minutes earlier, forgetting whether she'd taken her morning pills, occasionally losing her train of thought mid-sentence. Margaret herself noticed it too, and quietly started worrying it was the beginning of something serious, the words she didn't want to say out loud, even to herself. Here's what a full medication review might have looked like for someone like Margaret. She was taking an over-the-counter allergy medication nightly, year-round, because it also helped her sleep without realizing it falls into that first category we talked about, the acetylcholine blocking family. She'd also been on a low-dose anti-anxiety medication for several years, started after her husband's death, that falls into the second category, the dimmer switch sedatives. And her blood pressure medication, prescribed years earlier when she weighed more, hadn't been reassessed since she'd lost some weight, meaning it may have been doing more than it needed to, nudging into that third category, the blood flow dips. None of these on their own would necessarily be flagged as a problem, but laid out together on one page in front of one doctor who took the time to look, that's a different conversation. In a composite case like this, a doctor might adjust the antihistamine to a non-drowsy daytime option slowly and carefully reassess whether the anti-anxiety medication was still the right long-term fit with the patient's input and recheck blood pressure sitting versus standing to see if a dose adjustment made sense. None of that happens overnight, and none of it happens without that person's own doctor guiding each step. These are not changes anyone should make on their own based on a video. In a realistic version of this story, improvement isn't dramatic or immediate. Over 2 or 3 months of gradual, supervised adjustments, someone like Margaret might notice she's repeating herself less, that her thoughts feel a little less like wading through fog, that she's not losing her train of thought mid-sentence quite as often. She's not cured of anything, because there was nothing to cure in the first place. The conversation simply uncovered some signal interference that had built up quietly over years, and clearing some of it away gave her own brain room to work the way it normally would. It's worth saying clearly, this is one illustrative pattern, not a guarantee, not a promise, and not a substitute for what your own situation actually looks like. Real results vary enormously from person to person, depending on overall health, other medications, and the specific reasons each prescription was started in the first place. What matters isn't this exact story, it's the underlying idea. Sometimes what looks like the beginning of cognitive decline is actually an accumulation of ordinary, well-intentioned medications quietly working against each other. And that accumulation is something a doctor can actually do something about once someone takes the time to lay it all out. So let's bring this back together. 3 categories, 3 different mechanisms, 1 underlying idea. The first category blocks a chemical signal your brain needs for memory, quietly, through medications that seem too ordinary to suspect. The second turns down the brain's overall alertness like a dimmer switch, trading a calmer night or a calmer mind for a slower, foggier memory system over time. The third interrupts the brain's fuel supply in small, repeated waves, dropping blood flow just enough, just often enough, to look like aging when it's really a dosing issue. None of these are about one bad pill, and none of them are anyone's fault. Not the patient's, not the doctor's. They're what happens naturally in a healthcare system where appointments are short and specialists don't always talk to each other. The honest takeaway here isn't medications are dangerous. It's that supporting your memory as you age sometimes means less about adding something new and more about taking a careful, guided look at what's already there. Now, an important caveat, because this matters more than anything else in this video. Everything you just heard is educational information, not medical advice, and it's not a substitute for an actual conversation with your doctor about your own health and your own medications. Please don't start, stop, or change the dose of any medication based on a video, including this one. Some of the medications mentioned in general terms today can have real risks if stopped abruptly, and only your prescribing doctor knows your full picture, your other conditions, your other medications, and your specific history. What this video is good for is preparation, knowing what to ask and why before you walk into that appointment. So here's this week's plan, and it's simple. First, write down every single thing you or your loved one takes. Prescription, over-the-counter, vitamins, supplements, all of it on one page. Second, circle anything that fits one of the 3 categories we covered. Things for allergies, bladder, sleep, or muscle relaxation. Anything for anxiety or sleep specifically, and any blood pressure medication. Third, book an appointment specifically framed as a medication review, not just a regular checkup, so there's time set aside for this conversation instead of squeezing it into the last 2 minutes. Fourth, bring up blood pressure checked both sitting and standing if dizziness on standing has come up at all. And fifth, write down the specific memory changes you've noticed with rough timing, so your doctor has something concrete to work with instead of a vague something feels off. You're not depriving yourself or your loved one of anything by doing this. You're adding one supportive habit, a clearer, more complete conversation with the person whose job it is to help. If this was useful, the next video in this series looks at something just as overlooked. How sleep quality itself, separate from any medication, shapes memory in ways most people don't realize until they fix it. It's a natural next step from everything we talked about today. Until then, take care of yourself and take care of the person in your life this video made you think of. I'll see you in the next one.